allow members of our community to be healthy. It is the Desert Healthcare District's responsibility to maintain and improve the healthcare infrastructure of Coachella Valley. In 2018, voters approved the district's expansion to cover the entire Coachella Valley. This doubled the size of the district, geographically speaking, and it also doubled, or more than doubled, the size of the population we serve. It also exposed gaps in services and unmet needs and greater disparities in access to healthcare. We're now proactively working to strengthening the healthcare infrastructure for the entire Coachella Valley with the premise that a healthy community is a more productive community, it's a more prosperous community. The COVID-19 outbreak has come to expose the failures of our systems, and we want to make sure that we're building and strengthening our district and the healthcare infrastructure in Coachella Valley to face similar outbreaks that may come in the future, but more importantly, that we're building a much stronger healthcare infrastructure for our entire community and that we're keeping our population healthy. We have the honor and the privilege to have one of the 14 congressional districts in the United States that has a doctor representing us. And that doctor is here with us today. It is our Congressman Dr. Raul Ruiz, who's going to say a few words on behalf of Congress. Thank you.
You know, that picture of handshaking is going to be the one that people are going to post. I normally keep my hand in my pocket to remind myself. It's just another reminder for everybody to really try to avoid shaking hands at all possible. There's an instinct to do it, but I think that it is, during these circumstances, it's important if we have a button or a visual reminder. I want to thank Desert Healthcare District, CEO Dr. Barzaga, the board, the staff, and everybody who has viewed the Coachella Valley as one community and has had the mantle and the mission to improve the health of our communities, all of our communities, so that we can live a more prosperous life with wellness and in health. In terms of the COVID-19 outbreak here in the Valley, I think that it is absolutely correct. It is exposing some of our gaps, and it is really highlighting some of the lessons learned. I worked in the Eisenhower Medical Center's emergency department in 2009 during the H1N1 pandemic. So I have real life experience working in the front lines during an outbreak. I'm also trained in public health disaster aid at Harvard School of Public Health, and of course a physician, also educated at Harvard as an emergency physician. So it is through that lens of my education, my training, and my experience in disasters that I'm facing this situation and serving the community right now. And it is my goal as a member of Congress, as a physician, to put families and to put patients first. So I'd first like to talk about the policies that have passed in Congress to help people understand where we're at. First was the coronavirus emergency supplemental bill that contained $8.3 billion of emergency funds, more than $3 billion for research and development of vaccines, therapeutics, and diagnostics, the tests, $2.2 billion in public health funding for prevention, preparedness, and response efforts, and nearly $1 billion in support of state and local health agencies who are on the front lines, working night and day to defend our nation's health. Furthermore, there were provisions there to open up to $7.7 billion in low interest rate loans for small businesses throughout our country. And since the feds cut the interest rate to zero, I think that's something that will come to a big relief for our small businesses. Now, with that immediate priority funding to switch to turn the switch on, to have enough masks, ventilators, to start working on the vaccines and medications, to start reinforcing the front lines in the communities, the CDC and the public health experts started to recommend social distancing, which means that if you're sick, stay home. Which means that in organizations and institutions where people congregate in large numbers, like schools or certain businesses, to close down or work from home and use telework. That means that children are at home. That means that many of them may go without food and have food insecurity because the schools are closed. Or seniors won't be able to be mobile in order to get their meals. And workers not being able to go to work. And employees not being able to pay the bottom line. So that's why Congress immediately passed the Families First Coronavirus Response Act, which will give free testing for coronavirus to ensure that no one receiving a COVID-19 test will have to pay for it, which means that 2 weeks of paid sick leave to as many as 87 million U.S. workers and up to 3 months of paid family leave for parents whose kids' schools or daycare are closed, who have to take care of somebody at home if they're quarantined, if that person's quarantined, or who have to get the test or get treatment themselves. Furthermore, $1 billion was provided for food security to low-income pregnant women and mothers with young children, help local food banks like Find Food Banks here in the Valley, and for those to feed the low-income seniors and also our students at their meals. There were enhanced unemployment insurance to help states provide the resources and flexibility in their unemployment benefits to laid off or furloughed workers. And of course, healthcare security through additional funding to states for their Medicaid programs and here in Medi-Cal. And this will prevent states from cutting benefits, reducing their Medicaid role, or imposing greater costs on enrollees. Our work is not done. This Family First bill was passed by the president yesterday, or signed by the president yesterday, so it's now law. Now we're working on another bill, nearly $1 trillion for economic stimulus for the businesses and for families to ensure that we can continue these recommendations. Just one highlight, if I may, now that I have your attention. The idea that the public's health is a collaborative effort in order to ensure that everybody is covered, that everybody has access to the testing and the treatment is highlighted with COVID-19. Because if we don't do a universal approach to ensure that people have the education, the safe distancing parameters, then that exposes the weaknesses in the system. That is why I'm calling for a unified approach to stay home policies like Palm Springs has in all cities in the Coachella Valley, whether the county creates those safe stay home policies themselves or the cities do it collectively, because the cities that don't do it will have an increase in visitation by other residents, increase in population, and they will put their residents more at risk of spread of the coronavirus. Second, I'm calling for a strike force specifically created with the county, the state, and the local hospitals to work together to expedite the testing, the results, the discharge process, and with technical support, because the Coachella Valley is uniquely vulnerable and at risk than other areas in the state because of our demographics of the elderly and those with underlying illnesses. We need to prepare for the surge, listen to the doctors, the epidemiologists in our communities who are saying that we need to heed the warning. And with that, I'd like to pass it back over to Dr. Barzaga for closing remarks.
Thank you. So we want to close our remarks by saying that the district is not stopping its work, that we're launching the community health needs assessment to evaluate the needs of our communities beyond the outbreak of COVID-19, and that we can build a healthcare infrastructure that is informed with solutions that are proposed and identified by our communities. That over the next few months, once we have been able to overcome this crisis that we have with COVID-19, we will be working on the implementation of a health improvement plan to close the gaps that exist in Coachella Valley, and that we're building and strengthening the healthcare infrastructure to keep our communities safer, healthier, and in better state of being. So thank you very much.